Hi, it's Ken Robinson from Practical Financial Planning. Our article on Tuesday was about cognitive decline and managing some of the financial aspects around that not welcome life event. We're fortunate to have with us for today's video a friend of mine, Dr. David Lash. He's the medical director of Parkside Villa, a skilled nursing facility in Middleburg Heights, Ohio. Dave, thanks so much for joining us.
Pleasure to be here.
So we often think of cognitive decline in the context of very scary conditions like Alzheimer's or dementia, but uh, I was surprised to learn people can experience cognitive impairments from situations that can be reversible. Tell us about what some of those situations are like.
Well, there are two general characteristics or two general classifications to think about. First are those types of dementia which may have a very effective treatment. Now, admittedly, these are rare. The most common one would be a condition called normal pressure hydrocephalus, where parts of the brain begin to dilate. There's an overproduction of cerebrospinal fluid, and that can be treated with a surgical intervention, shunting some of the spinal fluid out of the areas of the brain with an improvement in cognitive function, or at least stability of those losses. The hints that would give us an idea of that is a classic triad of symptoms of cognitive decline, in urinary incontinence, and ataxia, or unable to stably walk. And these would be rather not rapid onset, but over the course of months, seeing definite changes occurring. So
Mhm,
faster than we would typically see in most other forms of dementia.
mhm.
The
I
other
was,
group to consider would be the medical deliriums. And these are more short-term acute causes of cognitive dysfunction with a very specific cause, either illness or medications typically.
mhm. I was surprised to learn that there are some very common experiences that particularly elders can have that can sometimes be very easily remedied, I'm told. Things like as simple as dehydration.
Dehydration can cause issues. Some over-the-counter medications can take someone who may have a mild dementing syndrome and make it much worse very quickly. The most common of these would be some of the older antihistamines or allergy or cold medications. Not so much the second generation, such as Claritin or Zyrtec, but some
Mhm,
of the older ones like Benadryl,
mhm,
which is also an ingredient in products like Tylenol PM that someone might try taking for sleep.
mhm.
Prostate issues in men, if they take a decongestant like pseudoephedrine, can cause an acute problem of urinary retention, which can then result in worsening of cognitive function. So
Yeah.
you have some very common medications that can get you into a lot of trouble if you're not careful.
And it sounds like if it's just an issue of a medication, that if there's a suitable alternative, maybe that cognitive issue can be reversed if there's another choice for how to treat their condition.
Well, there are other choices, and some of these conditions are not in and of themselves serious. So the treatment becomes much worse than the condition you're trying to treat.
Yeah, it's sometimes a very touchy subject as we're preparing estate planning or working with a client's lawyer to prepare their estate planning documents and identifying what their estate plan is. It's uncomfortable to think about when they might need help from someone else or when they might no longer be around. But it's interesting from a planning point of view to realize that the symptoms that we might see around dealing with numbers, where we're seeing, this used to come easily to you, now you're having trouble with it, that there could be good news out of the process of just getting them into their doctor's office to have them, look at things as simple as the sorts of things we've been discussing.
The the first characteristic to really look for is anytime there is a sudden or abrupt change. That's not typical for an Alzheimer's type of dementia. It could indicate a small stroke, or it could be a medication interaction, some other illness going on. But it merits some close attention to figure out what's happening here. Let's not make any assumptions too quickly.
Yeah, yeah. Well, as with many situations, when someone is on in years, if there's a significant change, it's probably better to get some questions answered sooner rather than later.
Yes.
Regardless of what the symptoms are. So, well, thank you so much for your insight. I appreciate your joining us today.
Well, thank you very much for the opportunity.
Sure. We've been chatting with Dr. David Lash, Medical Director of Parkside Villa, a skilled nursing facility in Middleburg Heights, Ohio. Please be sure to check the description of this video for a transcript and for links to the article from this past Tuesday. And don't forget to like us on Facebook and on LinkedIn.